Hello, coders. Welcome to yet another 3030 session by AMCI. So, today we are going to talk about moderate conscious sedation, allergy, and clinical immunology. And we will be covering everything from what moderate sedation is, the guidelines, CPT codes, to allergy testing, immunotherapy, and key coding tips you need to know. So get ready and let's code. So let's begin by reading the copyright. CPT Copyright 2025 American Medical Association, all rights reserved. CPC is a registered trademark of AAPC. AAPC content found within this presentation is a copyright of AAPC. Keyword concept FTR, Chun, AMCI Fab 7, AMCI ICD-10, Flip Tab, and MCG are the trademark of AMCI. The credential CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI do not own right to these credentials. Credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA. AMCI do not own right to these credentials. Moderate conscious sedation, allergy, and clinical immunology. These two topics falls under the medicine section in your CPT manual. So first, let's look at what moderate sedation or a moderate conscious sedation is and the guidelines associated with it. So the moderate sedation is a drug-induced state where the patients are relaxed, but they can still respond to the verbal commands and also to gentle touch. Importantly, during the moderate sedation, patients do not need help with the breathing or any cardiac support. They can pretty much breathe by their own. And these codes are time based codes. They range from 99151 through 99157, and they should not be used to report for the administration of the medications, which are usually given for pain management, minimal sedation, deep sedation, or monitored anesthesia care. And for reporting purpose, the intra-service time, which is the time the patient actually is under the moderate sedation, that is used to select appropriate codes. And we also have a pre-service time, which is the time before the intra-service time, time before administration of the moderate sedation. That generally includes the preparation time, and we will be talking about them in detail in the coming slides. And we also have a post-service time, that is time after the moderate sedation. Okay, so let's look in detail to what these pre-service time, pre-service work, intra-service time, and the post-service times are, and the work associated with it. Pre-service time is the period before the patient actually receives a sedation, during which all the preparation and assessments are done. So the pre-service activities required for the moderate sedations are included in the CPT codes 99151 through 99157, and they are not reported separately. And these steps include reviewing the patient's medical history, medication, allergies, past anesthesia experience, doing a focused physical exam on the airway, heart, lungs, and circulation, checking the vital signs, reviewing any pre-sedation test, completing the assessment form with ASA status, getting informed consent, doing a final check before sedation, and starting the IV access. So remember, coders, none of these time counts towards the intra-service time, which is used for the coding. Now let's talk about the intra-service time. This is a period when the patient is actually under sedation and it determines a CPT code to report. The intra-service time begins with the administration of the sedating agent and ends when the procedure is done, patient is stable, and the provider stops direct face-to-face care. This intra-service time includes giving initial and additional doses of sedatives if needed. The provider must stay with the patient continuously, monitoring the responses and adjusting the sedation as needed. Monitoring also includes oxygen level, heart rate, blood pressure, and periodic check of patient's condition. So, if the provider performing the sedation also does the procedure, then they supervise an independent trained observer to help monitor the patient's consciousness and vital signs throughout the procedure. And finally, post-service work. These activities are also bundled into moderate sedation codes 99151 through 99157, similar to the pre-service work, and they are also not billed separately. So once the provider's continuous face-to-face time ends, anything done afterwards is considered as post-service work. So the post-service work includes checking patients' vital signs, level of consciousness, and overall stability in the recovery, deciding if the patient is ready for discharge, completing the documentation of the sedation service, communicating with the family or caregiver about how the sedation went. So also coders finally remember the post-service work is required, but it also doesn't affect the code selection. The facts to remember for a moderate conscious sedation coding. Now, there are three important points which you should keep in mind. One is the age of the patient. So, as I said previously, the moderate conscious sedation CPT codes are time based code, and they are also classified based on patient's age group. So, whenever you see a question of moderate conscious sedation, make sure you inventory the age of the patient. Now, point number two, you have to see if the same doctor performs the surgery or the procedure and also administers the moderate conscious sedation. Yes, so if the same doctor performs both moderate conscious sedation as well as the procedure, in such cases you have to use a code series ranging from 99151 through 99153. Now, point number three, if a different doctor administers the moderate conscious sedation than the surgeon, in such scenarios, you have to use a code series ranging from 99155 through 99157. So over here, Dr. 1 does the procedure, and Dr. 2, who is specialized in anesthesia, provides a moderate conscious sedation. In such cases, you have to use a code series ranging from 99155 through 99157. So these are the three important facts to remember while coding conscious sedations. Now let's take a closer look into the codes for moderate conscious sedation. We have CPT code 99151 through 99153 that are reported when same physician performing diagnostic or therapeutic procedure also administers the moderate sedation. Next, we have code series 99155 through 99157 that are used when one physician performs a procedure and a different physician or qualified healthcare professional provides a moderate sedation. These codes are further classified based on patient's age. We have CPT code 99151 and 99155 that are used for patients age 4 year and younger, and codes 99152 and 99156 are used for the patients of age 5 year and older. There are also two additional or add-on codes in this moderate sedation series. They are 99153 and 99157. It is very important to note that 99153 should be used in conjunction with 99151 and 99152 only. And code 99157 should be used in conjunction with 99155 and 99156 only. Finally, coders, don't forget our FDR. You also always have to check the age of the patient who administers the moderate conscious sedation and the time of the moderate conscious sedation. And for those who likes to pick up the codes using a table, we have a moderate conscious sedation table in our CPT manual. So have a look, and they can be also be very handful in arriving at the correct moderate conscious sedation codes. Now let's move on to our next topic for the day: allergy and clinical immunology. So, what is an allergy? An allergy is body's overreaction to something that is normally harmless, like it can be pollen, dust, certain foods, or even medicines. So, the immune system mistakenly sees these substances as a threat and responds by releasing chemicals such as histamine. So, when an allergy is suspected, the physician considers multiple potential allergens guided by patient's medical history, physical examination, clinical judgment, and observations. So, based on this evaluation, physician may order and perform allergy sensitivity testing. So, he carefully selects the number and type of the allergens to match the patient's specific clinical needs. And as you can see in the image, a small amount of suspected allergens are pricked into the skin. And if you're allergic, a small raised bump will appear. And this is how an allergy testing is performed. Now, immunotherapy, which is also called as a desensitization, is when the allergic extracts are given by injection at regular intervals, starting with small doses and building up to a maintenance dose. So, whether or not immunotherapy is used, it totally depends upon the diagnostic testing, clinical judgment, and natural history of allergic diseases. Now let's have a look into the FDRs for allergic testing. So the code series ranges from 95004 through 95070. So first thing you have to check is the type of the testing. It can be percutaneous, it can be intracutaneous, it can be even a combination of both. So throughout these codes, you can see different types of testing. Also, code for number of tests performed. So if there are 10 tests performed, you have to code for all these tests. Ingestion challenge testing is another type of allergic sensitivity test. Here, the patient will be given small but gradually increasing amount of suspected allergens such as food. And the entire procedure will be performed under medical supervision and carefully monitored for allergic reactions. This test will be stopped immediately if the reaction occurs, with treatment provided as needed. Now, coming to the coding part, the CPT code 95076 is used for the first 120 minutes of testing, and add-on code 9507 9 is used for each additional 60 minutes. The physician's face-to-face time is not included in these codes. So few things to keep in mind is that if total testing time is less than 61 minutes, use appropriate E&M code. And routine monitoring activities like blood pressure or peak flow testing are not reported separately. Interventional therapy such as injection of a steroid or epinephrine can be reported separately if it is performed. Lastly, if an E&M service is required, the testing time stops at that point. Next, let's turn our attention to allergen immunotherapy. So as I previously said, allergen immunotherapy helps to reduce or even eliminate the allergic reaction over time by gradually desensitizing the immune system to specific allergens. Now before going into the codes, first let's look our FTRs. So allergen immunotherapy code series ranges from 95115 through 95199. And there are three important points to remember here. Number one, the preparation. See who prepared the allergenic extract. Did the doctor prepare or not? Number two, administration. Who administered or who injected the allergenic extract? Number three, the provision. Supply the product. Is there a provision to supply or not? And the coding tip. Pay attention to who is administering the immunotherapy because the physician may not always administer the injections. Now, with that said, let's have a closer look into these CPT codes. So, code series 95115 and 95117 is used when physician inject small, gradually increasing doses of allergen for desensitization. And 95115 is used for a single injection, while 95117 is used for two or more injection. Okay, and code series 95120 through 95134, they are for the professional services for allergen immunotherapy in the office or institution of prescribing physician or other qualified healthcare professional, including the provision of allergenic extract. Okay, now main two difference between these two groups is that 95115 through 95117, they do not include the provision. Okay, and 95120 through 95134, they include the provision of allergenic extract. And that is a key difference. And then we have code 95144. This is used when allergist prepares and supplies the allergenic extract in a single dose vial. And it is usually used or administered by another physician. Okay, so it is not injected by the physician or the allergist who prepares and supplies the allergen extract. Now, code series 95145 through 95170 is used for professional services for supervision of preparation and provision of antigen for allergen immunotherapy. It is very important to note that these codes include the preparation and provision only, and they do not include the administration of allergen immunotherapy. Okay, so 95140 is used for supervision of preparation and provision of antigen For allergen immunotherapy, single stinging insect venom. And 95146 is for two single stinging insect venom. And it goes on till 95149, which is for five single stinging insect venom. Next, we have CPT code 95165, which is for supervision of preparation and provision of antigen, single or multiple antigen, while 95170 is for whole body extract of biting insect or other arthropods. Next, we have code 95180, which is for rapid desensitization procedure for each hour. Example, we have insulin, penicillin, and equine serum. Finally, 95199, which can be used for unlisted allergy or clinical immunological service or procedures. So these are the codes which falls under immunotherapy services. And coders, it is time for some coding exercise. So are you ready to test your knowledge? I know you all are. So let's go ahead and let's do the first scenario. Of the following answers, which best describe Dr. Lee's moderate conscious sedation services? Option A 99151, 99153. Option B 99152, 99153. Option C 99155, 99157. Option D 99156, 99157. A 45-year-old woman undergoes a colonoscopy. She's extremely anxious, so Dr. Lee, trained in sedation, administers moderate conscious sedation. The sedation lasts 30 minutes, during which Dr. Lee continuously monitors her responsiveness, airway, and vital signs while performing the colonoscopy. A trained nurse acts as an independent observer, assisting with the monitoring the patient physiological status and level of consciousness throughout the procedure and recovery. Of the following, which best describe Dr. Lee's moderate conscious sedation service? And coders, I will give you about 1 minute to answer this question. All the best. And that is time. So, how are you all doing? Okay, let's break this scenario together. Let's first solve by listing our inventory. We have a patient age 45-year-old, colonoscopy and moderate sedation was given by the same physician, Dr. Lee, and a moderate sedation was given for a duration of 30 minutes, right? Yes. So let's bring up our code options, and from this I can eliminate two wrong answers or two wrong options on site, option C and option D, because they are coding for CPT code 99155 and 99156, and both are for a moderate sedation provided by a physician other than the physician who performed the diagnostic or therapeutic service, right? So that means One physician performed the procedure and other performed the moderate sedation. And that was not what happened in our scenario. In our scenario, Dr. Lee performed both the moderate sedation as well as procedure. So option C and option D is incorrect. Now we are left with option A and option B. So option A, coding for 99151, that is for moderate sedation, provided by the same physician who performed the procedure as well. And that is for patient of age younger than 5 years of age. Okay, and 99152 is also for a moderate sedation provided by the same physician who also provided the procedure or performed the procedure. And the age category is 5 years or older. Now it is time for us to check our inventory for the age of patient, and it is documented that the age of the patient was 45 year, and that would help us eliminate option A, and the correct answer would be option B, 99152, for the moderate sedation provided by the same physician performing diagnostic or therapeutic surveys of patients age 5 year or older, and 99153, which is assigned for additional 15 minutes because the moderate sedation in our scenario was given for a 30 minutes, right? So we definitely need to code the add-on code as well. And if you are a person who likes to select the code using the table, you can do so. All you have to do is first identify or locate the time. It was 30 minutes of moderate sedation given, and then locate the correct age. For our scenario, the age of patient was 5 year or older. And next, you can pick the correct code by checking whether the moderate sedation was given by the same physician who also performed the procedure or not, right? So here in our scenario, both was given by the same person, and the correct code would be 99152 and 99153. So yes, it is also pretty easy to pick the correct answer using this table. Fantastic job, coders. Let's move on to our second exercise. Of the following answers, which best describe the surveys? Option A, 95004 times 12. Option B, 95017 times 12. Option C, 95028 times 12. Option D, 95024 times 12. A 28-year-old patient presents with chronic allergic rhinitis symptoms that have not responded well to over-the-counter medications. Allergist decides to perform intradermal testing to confirm sensitivity to common environmental allergens. The allergist administers dual intracutaneous intradermal tests using various common allergenic extracts. The allergist observes the immediate reaction, interprets the result, and documents a report of the findings. Of the following answers, which best describe the encounter? And coders, your 1 minute starts now. That is time and Great job, great coding, excellent work. Okay, so let's break this scenario. In inventory, we have a patient with chronic allergic rhinitis. 12 intracutaneous intradermal test was performed, and this is an immediate type reaction. So these are the FDRs for allergic testing. All you have to do is to find the type of the testing and also code for number of tests performed. So keeping that in mind, let's go ahead and look into option A. Now that's coding for 95004, which is for percutaneous test, right? And we had a intracutaneous intradermal test performed in our scenario, not a percutaneous. So option A is incorrect. And option B coding for 95017, which is for a combination of percutaneous and intracutaneous test. Again, we didn't have a combination test performed. That eliminates option B also. Option C is coding for 95028, which looks like a good code. It is for intracutaneous intradermal test with allergenic extract delayed type reaction. Yes, that's where option C is incorrect. It's for a delayed type reaction. And as I said, we had an immediate reaction, which eliminate option C. And the last remaining option, which is the correct answer, is going to be 95024 times 12. That is for a intracutaneous intradermal test with allergenic extracts, immediate type reaction, including test interpretation and report. You have to specify the number of tests. We have 12 tests performed. So you have to append times 12 along with it. And that makes option D the correct answer, 95024 into 12. So great job, coders. You all rocked it. Excellent job.